Yes, there are huge gaps. Yes.
Communities must get onto the table when programs are being designed and implemented, and altogether monitor how programs are being done.
Those are our 4.
This was one of the remarks made during a knowledge dissemination forum bringing together a network of community health promoters drawn from different regions in the country in Naivasha.
So we are having that conversation.
The meeting saw various experts share lessons on the best practices from diverse community systems strengthening interventions with a focus on conditions such as malaria, TB, as well as sexual and reproductive health. According to officials, 80% of the burden on healthcare sits within communities. With this, the government ought to engage communities to play a role.
For instance, when we had the issues of COVID, it is the communities that came first to mobilize themselves to respond to COVID and even to support their community members in terms of uptake of services. When there was the issues of the flood, it is the community themselves that organized, mobilized themselves, and also supported their fellow communities in terms of rescuing them, in terms of food support and such kind of support. So when we talk about the community system strengthening, we are looking at the whole spectrum. How do we look at and how do we mobilize, build capacity of communities so that they are able to respond?
They observe that information generated from communities forms national level advocacy with policymakers for a solution to be sought.
We have something we are calling iMonitor, which is an alert system where somebody goes to a health facility and probably there are no drugs. They just report in an application using their phone to say this facility is lacking drugs. That is important to help the counties. For example, some of the counties like Homa Bay have taken up this seriously and are able to really say we have drugs in point B, point C is lacking. How do we ensure that those drugs move there? But in a bigger picture, essentially, is to really say, then now what do we do with all this information that is coming from different places? It then forms a bigger aspect of national level advocacy with the policy makers to really say, what is it that we can then do?
The government was called upon to expand community health promoters program to reach all households, further ensuring that they are financially compensated, upskilled, equipped and supervised will go a long way in accelerating progress towards universal health coverage.
We want to make it even more pronounced as we move forward, as we move towards 2030, when we put a cap for universal health coverage, that we are going to involve everybody in an integrated manner so that we move away from siloed programming where CSS is with AMREF at the corner, then we have community health within government in another corner, and yet you're all working for the same communities.
Gertrude Burgay, K24 TV.
Snap it again.